and perhaps most importantly, the author of a great book called Preventable, about what went wrong and what went right in the pandemic, and how we can be better prepared for the future. Among Andy's many skills, he turns out to be a great writer. So it's an important book and a great read. People should go get it. Then we're joined by Dr. Jennifer Nuzzo, who's a doctor of public health, who's a senior scholar. I have to look this up. There's Johns Hopkins Center for Health Security and an associate professor in the Department of Environmental Health and Engineering and the Department of Epidemiology at Johns Hopkins. And by Dr. Jeff Ebner, a practicing family physician in Madison, Wisconsin, who's treated COVID patients and a member of the board of Doctors for America. So before I turn the call over to the center, let me say some very quick words. Cases are rising across all 50 states for the first time in 6 months. And states that have fully vaccinated or close to fully vaccinated their people are obviously doing far better on that statistic. And the unvaccinated make up 90% of those being hospitalized and those dying from COVID. A stark statistic that shows the importance of continuing to help people understand why it's so important that they protect themselves and their families. But at a time when every elected official should be doing everything they can to urge people to get vaccinated, instead we're finding too many folks on Fox News and too many people in the halls of Congress spending their time attacking the experts and spreading false conspiracy theories. This failure to lead and this decision to put personal politics or desire to sell merchandise on their fundraising websites is putting America at risk. If we learned one thing from the last year and a half of this pandemic, is that it's important to listen to the experts, those who are not playing politics with our health, but those who every day put their best expertise to work for all of us. And so that's a threat that we're facing today as we see mounting attacks on these experts. And with that, I want to turn it over to Senator Van Hollen for his remarks.
Well, Leslie, thank you for pulling us all together today. Thank you for what you do at Protect Our Care over the years, including defending the Affordable Care Act and expanding access to affordable care, and now being, at the tip of the spear and trying to make sure we get the truth out about the importance of taking vaccines in order to save lives. And I'm pleased to be joined by those of you already introduced: Andy Slavitt, Jennifer Nuzzo, Dr. Nuzzo, and Dr. Hebner. Look, as you mentioned, I represent the great state of Maryland along with Senator Cardin in the Senate, and we're very proud of the fact that both NIH and the FDA have their home here in Maryland, and it's home to scientists who've been at the forefront of discovery in terms of the vaccines that we're now using to fight COVID-19 and at the forefront of the public health effort to protect the American people. So it's been absolutely disgraceful to see members of Congress, the House and the Senate, to see right-wing talk show hosts and others attack the credibility of the scientists at a time when it's more important than ever that the American public hear the truth. And, more than shameful, it's downright dangerous because, as you mentioned, we're continuing to see the spread. In fact, we're seeing the spike of the Delta virus. And, if you're looking at the states with the 7-day death rate per 100,000 people, we're talking about Arkansas, Montana, Wyoming, Maine, Missouri. And it's very important that elected officials and leaders in those states join with the healthcare experts rather than be fighting against the healthcare experts in order to make sure that we vaccinate the American people. There is, of course, the good news that half the country is now vaccinated and 68% of adults have received at least one dose, and that these vaccines are safe, they're effective, they're free. And of course, in the American Rescue Plan, we devoted $15 billion to the effort to vaccinate people, and $50 billion to ensure continued testing so that we could isolate and identify hotspots and isolate people to prevent the spread. But we're here today because those numbers are not good enough. And we have seen vaccine hesitancy continue to exist and spread. It is costing lives. You mentioned, Leslie, the figures with respect to hospitalization. 90% of people being hospitalized have not had a vaccine. And of course, the CDC director just again reminded us that essentially 100%, 99.5% of those people dying from COVID-19 today are people who have not gotten vaccinated. So it's really important that we unite behind the facts, behind the science, that we stop the attacks that we've seen on people like Dr. Fauci. I do think that the efforts that you've been making, Leslie, and others are beginning to have some impact. We have seen just in the last 48 hours more Republican elected leaders who'd been silent or who'd been sort of dismissing the science begin to call on people to be vaccinated. We've seen some progress in the last 48 hours, even among some of those talk show hosts, but we have to keep the pressure on, because every day that goes by that some misinformation is allowed to spread, whether it's intentional lies or just people who haven't bothered to get the facts, every day that goes on, more people die. And so let's keep pushing. As we all know, this virus doesn't differentiate or distinguish based on political party or political views. And people of all political parties and all political views should be interested in spreading the truth and saving lives. So thank you all for being part of that effort.
Thank you, Senator, for all you do. And really, this is a time to put America first, if there ever was one, and for people of all political parties to do the right thing by their people. Just for our reporters who are listening, we will have a question and answer session after this, and we'll give folks further instructions about how to use the chat function for that purpose. Let me now turn it over to Andy, who I am proud to know as a friend, but also proud to have worked and seen what a contribution he's made to America's health, both on the job in government as a private citizen. So Andy, great to have you, and thanks.
Thank you, Leslie. It's great to be with all of you, Senator, who I admire so much for the work you do to fight for everyday Americans. And I'm excited to hear from Dr. Nuzzo next. I think the work that you've done is just outstanding, incredible. And I think, the job is really to get the right information to light. I mean, we are in an all hands moment if the country has had one in the last several decades. I'm 54, and in my lifetime, there's never been a greater time when it makes sense for us all to pull together. And I think that's exactly what the president is asking the country to do, and that's exactly what he's trying to do. But the context of 2021 is growing more and more interesting and potentially troubling by the moment. 2020, we were relatively helpless against a fast-growing virus. We didn't have any tools. 2021 is different in that we have an even faster growing virus, probably twice as fast as the 2020 version. Yet the difference is we have a tool that's even better. We have a tool that can stop it. And that should give us great comfort. And it's the work, quite frankly, of many, many, many people over decades to get to the point where we have this vaccine. It's the work of Democrats and Republicans. It's the work of the private sector, the public sector, but mostly it's the work of scientists and basic research that we funded through the NIH over the course of time. And the vote of confidence in our country to invest in the things that will protect us could never be more clear. So the people that are getting sick, going to the hospital, and dying in 2021, I would argue this is entirely preventable. If not entirely preventable, it's almost entirely preventable. And that's sad. Now, let me be clear. People have valid questions about whether they want to take a vaccine or not. No one is suggesting that people should be talked into taking a vaccine or doing something against their wishes. Nobody. What we are arguing is that people should have access to real, truthful, honest information so they can make the decision. And we believe that most people, the lion's share of people, will make that decision to get vaccinated because the record of these vaccines is so extraordinary, both from a health standpoint, a safety standpoint, and also a results standpoint. So And I know I talked to countries around the world. I was on with Australia this morning. They would absolutely give anything to have the access to the vaccines that the American public has. So if we were working against people's honest questions and getting them reliable answers with trusted people, that would be one thing. But unfortunately, sadly, as the senator pointed out, we're not. We're also working against one another yet again. In yet another repeat of 2020, people have decided to politicize the issue of vaccines for some reason. And I think, having spent time with Facebook and interviewed them, that they're on my podcast this morning, and having listened to several Congress people and how they've chosen to try to raise money off of this, I would tell you that misinformation is a business. It is a business. Convincing people not to get vaccinated is a way to either raise money politically or to promote engagement on a website. And this is not what we should expect of each other during a pull together moment. So we have people at risk. Young people are at risk. My 19-year-old got COVID 6 months ago, still experiencing symptoms. That's a kind of risk I don't wish on anybody. People who are in rural communities with low vaccination rates are at risk. People who are living in hourly jobs, who have to interact with the public, they're increasingly at risk because of this irresponsibility. So when a senator, with all respect, not the one on this call, but a senator who chooses not to get vaccinated and bring COVID into the US Senate, decides to challenge the very scientist that's been developing these vaccines for 2 decades and to save millions of lives, it's a clarion moment for all of us to step back and say, whoa, why are we letting these people who really are working against our best interest so damage our country? I can tell you finally, just as a final point, I'm so pleased that the president remains committed to every single American. He is not letting the divisions, he's not letting the bait being thrown at him take him off course. And if it takes longer and if it's harder, he's willing to put in the effort to make sure we all get to have these conversations with people. What we need to do is we need to call on people who are not part of that process to get out of that way. If Rand Paul does not want to take a vaccine, that's his right. But his influencing others not to take the vaccine is dangerous, and we need to call it out for what it is.
Andy, thanks. Thanks for those really passionate remarks from the front lines, because you've been putting together so many of these programs that have kept America safe. You've been talking to experts around the world, businesses here at home, and to have your perspective and your passion about this is great for America. And thank you for doing it. Let me turn now to Dr. Nuzzo, who from Johns Hopkins, to give her perspective on the science and what listening to the science means for the American people.
Yeah, thanks so much for the opportunity to speak. And thanks, Andy, for those excellent remarks, and to the senator for convening all of us. I have been doing calls and outreach events like this since pretty much January of 2020. I testified at the first government hearing on what was still sort of a emerging outbreak in Wuhan, China. And having followed the situation, from the very beginning and seeing the arc that we've gone through, maybe I can offer some few thoughts on where we were and where I think we're headed. First of all, I would have never imagined, even wildly possible, the idea that we could have multiple vaccines approved for use that are as safe and effective as the ones we have are. That is a dream. And I am so incredibly grateful for the foresight of the amount of research that has gone in over the span of decades to not only improve our understanding of coronaviruses and how to develop countermeasures against them, but also investments in researching messenger RNA technology and adenovirus vector technology that underpins some of the vaccines that we have. It's an extraordinary development, and as far as I'm concerned, a real triumph of science. And given the outsized role the U.S. has played in all of that, I'm enormously proud of our national contribution to that. We have seen tremendous tragedy throughout all of this. The world just passed a very grim milestone of over 4 million reported deaths just recently. And the thing that strikes me so much about this and all of that loss that has happened is that most of it has actually happened since we have developed vaccines. So while every human life lost is a complete and utter tragedy, to think of the fact that people are still continuing to lose their lives despite having tools on hand to essentially prevent that from happening, it's just hard to put into words what level of tragedy that is. And that's not just the global case. That's also just looking at the United States. We are in a very, very worrisome phase right now. We have obviously made important strides against this virus. And, several months ago, I think we're looking quite optimistically about a summer free of COVID and potentially heading into the fall quite well. But unfortunately, our efforts have slowed, and our rollout of vaccines are meeting tremendous amount of resistance that is just unfortunately setting us back farther than we absolutely need to be by now. We, of course, are not helped by the emergence of and spread now and dominance of the Delta variant, which is far more transmissible. But to now be in a situation where all states are reporting case increases, more than half, more than 30 are actually also reporting increases in cases and hospitalizations. And, about half of those are also seeing increases in deaths. Having that now months into our vaccination campaign is just, it really sort of, it's hard to comprehend. I am quite worried about what's happening, in part because although the harms have been far greatest in the states where vaccination uptake is the lowest, we are still seeing pockets in nearly all states where vaccination uptake is not nearly what it should be, and in fact, in some places are quite low. So even high vax states still have counties that have very low vaccine coverage, and unfortunately, those are the places where the case increases are happening the largest. So what that means is that all states remain at risk of seeing, again, worrisome case surges and deadly rises in hospitalizations. We've learned a lot about how to treat COVID and how to save people's lives, but our abilities to be able to do that depends on there being enough resources in the system to be able to provide life-saving care. And when there are surges of patients that are beyond what hospitals can do, then people who have otherwise could have been saved are unfortunately not going to be. So we are really at this moment where we need to do something about this. And I continue to be deeply dismayed by the current national dialogue, local dialogue about vaccines. One of the things that I've done since the beginning has to do webinars like this and engage with groups. I have done many sessions about the vaccine with vaccine hesitant groups. I have talked to healthcare workers. I have talked to celebrities. I have talked to QAnon conspirators. I've spoken to moms. You name a group, I have probably spoken to them in one form or another, answering very reasonable questions about the vaccines. I am happy to do that. And I know many people like me who have some knowledge feel called to do this and are very willing to do it. It's incredibly difficult to have these conversations when the same false beliefs, not just questions. I mean, we're happy to answer questions, but oftentimes you hear of the same false beliefs over and over and over again. The statements are so similar when you hear them that you know they have come from the same sources. And in fact, what we have found, that is exactly what's happening. There's a group called Center for Combating Digital Hate that did a really important report that has gotten some media attention as of late, finding that the vast majority of anti-vaccination content on the internet stems from 12 personalities, essentially, who are making a tremendous amount of money off of spreading lies. It's more than a $36 million industry. They are making money, but people are dying. And this is really, really difficult. This is not something that doctors and nurses and public health professionals like myself can just risk communicate our way out of. It is far too great, and we need a national plan to address it. We also need protection. And I will tell you, I am not somebody who is on the news nightly. I do appear, but I'm not a national spokesperson. I'm not Dr. Fauci. I'm not, the person who appears, who hasn't even an official position in all of this. Nonetheless, I personally have been attacked by a cable TV news host at least 4 different times, each time resulting in a cascade of threats. to the point where my university has had to take action to make sure my family is safe. And I also know that I'm not alone in this. Many of my colleagues have also experienced very similar things. We're there to share what we know, and I try to do so without judgment. I don't judge people who don't want to get vaccinated, but I'm happy to answer questions. But I also don't expect, as part of the job, to fear for my safety. So we really need to do something about this. I don't talk about the cable thing that publicly because I don't want to amplify the hate, but unfortunately, I think given where we are and given that the rhetoric is not settling down and given that many more people are going to lose their lives in the months to come unless we do something about this, I think something has to be done. So I'll just end there and just hope that we can all pull together as a nation to protect each other and to make sure that at the very least, if it's fine if people want to make the decision not to be vaccinated, but to make sure they do so based on facts and not lies.
Thank you for those sobering remarks. Something for us all to think about, and hopefully for those who were putting their personal finances or their personal politics before the safety of Americans. I hope they heard it too. Let me just mention for the folks on the line, we'll be using the raise hand function to take questions. So if folks want to put some questions there, please go ahead. And we'll now turn it over to Dr. Ebner, who of all of the folks on the calls has been seeing patients in the hospital from COVID and treating them.
Hi, everyone. My name is Dr. Jeff Hebner. I'm a family doctor in Madison, Wisconsin, and I work actually in an outpatient clinic setting, seeing patients, and also have been involved with a lot of vaccine education and community health education and engagement efforts over the past many months, both prior to launch of the vaccine and with the implementation of the vaccine work. And I'm just really thrilled and honored to be a part of this panel and this group. Thanks, Senator, for your leadership. Andy, for your incredible work and service to this country and helping us all to have vaccines to put into arms, and Dr. Nuzzo for your incredible leadership during this time. I have the privilege and honor to work individually with patients, and I thought I might share a little bit of the perspective I'm encountering that way and a few thoughts just about where we're at with things. If I look tired, often it's because of patient care, but this time it's because I was up late helping celebrate our awesome Milwaukee Bucks win last night for a basketball championship, which was brought in part by the vaccine. So for people who are getting vaccinated, people are getting back to normal fun things. And it's really been awesome for the state to come together behind that run. For people who are on the fence about whether to get the vaccine, now really is the time. For people who are unvaccinated, unless you're never going to leave your house and go out and see people, it's really not a matter of if you're going to get COVID. It's a matter of when. And I've seen the range of effects. People know that some people do fine when they get COVID, but many people suffer long COVID, and obviously hundreds of thousands of people in our country have died, including in this state of Wisconsin, thousands of people, and obviously worldwide, millions. And those deaths have been tragedies. And as Andy hit before, and I think Senator Van Hollen, we're at a point in this pandemic now, due to the miraculous vaccines that we have, based on the great research that has been done over the many years, where nearly every death is preventable. So I want to be a part of continuing to help my patients and my community get vaccinated as quickly as possible, or else we're just going to keep muddling through this pandemic, and more people will die tragically, and we're not going to be able to get back to our jobs and school with the same confidence we would if people are vaccinated. I just want to reiterate a few important facts. One, as it was mentioned earlier, nationally and locally, over 99% of the people that are dying in this country of COVID have not been vaccinated. I think it's really important to understand that. And if you hear some noise about people who have been vaccinated and had positive cases, and I've seen a few of those in my own practice, they all do incredibly well. They're not playing roulette anymore. They're going to be protected. Most likely they will not have serious symptoms at all, and they certainly aren't going to die from COVID. In the communities and states with high levels of vaccination, they're having the lowest caseloads. And we've seen that here. I'm really fortunate to live and work here in Madison, Dane County. We have one of the highest vaccine rates in the country. And our caseloads are low still, even through this uptick, although they are starting to creep up. And they're certainly creeping up here in the state of Wisconsin. But we're having a fun summer, and I invite everybody to do the same. And I just want to say too, again, about side effects. They're minuscule generally compared to what COVID can do. COVID can ravage every part of your body, even if you don't die from it. And it's really important to understand that the side effects are low, if you have any at all. So what do my patients say? The vast majority have gotten vaccinated, thank goodness. Whether it's myself, my colleagues, my patients, my family members. I mean, most people say they have a sore arm. Some people get quite tired, especially after the second shot for a day or so. But most people sail through without any problem, and certainly no problems compared to what COVID can do to you. For people that might have a relevant allergy, we usually can find a way to help you get you safely vaccinated. I do have a few patients who are still thinking about it. I just had a conversation with one this morning who has a lot of medical issues, actually. And he was just in the hospital for something else related to his diabetes, and I worry about him. He had some good questions about it. I mean, we had a good conversation. When I talk about the vaccine with my patients, I listen to what their questions are, what their thoughts are, their concerns. I ask them about their experience with prior vaccines. I've had other patients who've experienced some side effects with other vaccines, and so understandably, they have questions. And I hope I can answer them. And I answer them always with the facts that are out there.
Hey, Jeff, I'm sorry to interrupt, but I just think if you don't mind wrapping up so we'll have time for questions. I apologize, but that would be great.
Yeah, you bet. So I think it's just really important to know that patients are sometimes experiencing and reading that misinformation that's being amplified very irresponsibly in the social media ecosphere, but also by some politicians, including Senator Johnson here in Wisconsin. So how do we counter this? I'd really ask for all of us to work together. As Andy said, let's pull together. I mean, nurses and doctors have pulled together in incredible ways. We're tired, but we've pulled together to help our country during this pandemic. And we're asking our politicians to do the same thing. And I think it's just really important to know every death is preventable. Any death at this point is one too many. And I would ask, everyone out there, if you have questions or concerns, talk to your family doctor, and we'll get you through it. So thanks very much.
Thank you, everybody. Let me ask my colleague Jason just to let the reporters know how to get in line for questions if they have any. Jason?
Yeah, hi folks. This is Jason. So if you have a question, you'll see at the bottom there's a raise hand feature. So you can just go ahead and click that. That'll let us know that you have a question, and then we will allow you to talk. I already see some folks have questions. So I think first we're going to go to Amanda Engel at WMAR. Amanda, you should be ready. You should be able to speak now and ask your question.
Hi, can you hear me?
Yes.
Okay. I was wondering, this is a question, I guess, for Dr. Nuzzo and Dr. Huebner. How would you combat a deeply ingrained conspiracy theory that a patient is coming to you with if they're avoiding the vaccine?
Somebody who would like to go first? Jeff, go ahead.
Those are difficult ones. I mean, the conversations when I can see and hear that a patient is repeating or talking about information that's non-factual are really challenging. And I would just say that that's why it's important to have a personal physician and people in your sphere that you trust, because it's going to be multiple conversations over time and trying to open up with them about what their concerns are and then answering about what the facts are.
And maybe just add to that, first of all, a lot of the people that I talk to who feel this way about vaccines don't actually have a personal physician, which is, I think, probably part of where some of their hesitancy and distrust comes from. If the medical system hasn't been there for you before, why would you think that there's suddenly a tool that it has for you? I think some of the research shows that, at least in the United States, people are probably more likely to be influenced by friends and family. And so I think that this can't just be on physicians and clinicians. I think that all of us have a role to play in addressing hesitancy and overcoming these these beliefs. I will tell you, in the conversations that I've had with people, what usually works out better is, rather than just countering the lies with facts, but is to give space to whatever underlying fears are motivating their gripping onto those facts, and trying to hear more about what their real concerns are, and then to try to couch vaccines as, possibly a way to fit into their lives, as opposed to, couching it in terms of the risks that they probably don't believe apply to them. I know in a lot of the moms groups, talking about how, this just makes their lives easier resonates a lot more with, your child who's probably low risk may get this thing that happens infrequently. So I think it's just about knowing the person and what their motivations are. And unfortunately, that can't happen probably in an office visit, and the amount of time that clinicians have to cram everything in, though I think they have an important role to play it. But I think it speaks to why all of us need to play a role in this and arm ourselves and have conversations with our loved ones.
Thank you. Jason, go to the next question.
Yeah, our next question is going to be from Jonathan Wiseman at the New York Times. You should be able to speak now and ask your question.
Okay, hi. This is Jonathan Wiseman from the New York Times. I wanted to ask probably Andy and Senator Van Hollen this question. Are there any federal policies that are not being pursued yet that should be pursued for this last mile on vaccines? For instance, could President Biden mandate vaccinations for federal employees and the military to set an example for private sector employees? And Andy, why hasn't he? And for Senator Van Hollen, I mean, you guys have passed enormous amounts of money already, but is there anything left for Congress to do on this front?
Andy, do you want to go first? You're on mute.
Sure. Senator, would you like to go first?
No, go ahead. I just was on mute too.
Yeah, that's a pandemic side effect for sure for both of us. Look, everything should be on the table. All solutions should be on the table, and I can tell you that's the culture and the attitude inside the White House. Every American counts. Every idea matters. Everything should be pursued with honesty, with clarity, and with a focus on science. I think once the FDA grants final approval to Pfizer vaccine, which we are, which was within weeks, maybe weeks to a short number of months. And look, I know people are impatient with the FDA and they want this to happen quickly, but I will tell you that the FDA, the policy of the Biden administration to keep their hands up and politics away from scientific decision making is the right policy. Once that's done, though, I'm confident it will be approved. I think there should be a lot of things on the table. I think every employer, every municipality, every venue, every government agency should be asking themselves the question, how do we ensure that we have safe space here? And to do that, that means that I would propose that everybody coming into my workspace or my venue is either vaccinated or, alternatively, if they choose not to, takes a daily test every day and shows a negative result, maybe at their own cost. So I think there's lots of room to do this. I think all these things should be on the table. They're complex issues. I'm not suggesting that they're easy, but I think there will be room to move aggressively. And I think also communicate to the public that's been sitting on the fence and saying, I want to see this play out before I decide whether to get vaccinated. Well, that's what the FDA has been doing on our behalf. And so when the FDA comes back, I think it'll be a great opportunity for people who feel on the fence to say, okay, this is what I've been waiting for. And I think we should be pushing that conversation fairly assertively.
Thanks, Andy. Senator?
Just Jonathan, thanks for the question. Just to follow up on what Andy said. Look, I as you said in the question, we have provided lots of resources to get the vaccine out. And obviously the initial results were very encouraging, but now we clearly have to finish the job. And a big part of that job, obviously, is this misinformation we're facing. I do think that with respect to things under federal jurisdiction, we should continue to keep all ideas on the table, as Andy said. I mentioned some of the great federal resources we have in Maryland at the outset, NIH and FDA. We also have great health and education facilities like Johns Hopkins, University of Maryland, and both of them have decided that with respect to their students, in order to return to class in the fall, individuals have to be vaccinated. We just saw the case, of course, with University of Indiana University and the court decision there. I do think that we should not be certainly discouraging these, other either nonprofit educational institutions or private sector institutions from acquiring vaccines, or as our medical experts have said, unless there's some very clear medical reason not to. And if that happens, as Andy said, have a testing option available. That's obviously what's required in many places now. So I think if you look at the vaccination rate among federal employees, the latest figures I saw were very positive, but this is something that I think should be reviewed going forward, especially if cases continue to spike.
Thank you. We have a few more questions that I also, obviously, some of our participants may need to leave. And if they do, please go ahead and follow your schedules, but we'll take as many questions as we can. Jason?
Yeah, the nenext question is going to go to David Lim at Politico. Excuse me. David, you should be able to talk now.
Hi, thanks for taking my question. Tied to, I know this is on vaccinations, but I wanted to ask about the data surrounding COVID and variants and how that might impact people's perception of the importance to become vaccinated. So 2 questions here. One is the CDC definition for breakthrough cases among individuals who are not hospitalized and the decision to not track those and make those public. And then second is the prevalence of different variants of concern and CDC's decision to only update that publicly once every 2 weeks. So I guess this is for Andy and Senator Van Hollen. What is the importance of communicating the risk and the prevalence and the caseload in an accurate manner at this stage of the pandemic as people try to consider if they should get a vaccine?
Well, I actually think Dr. Nuzzo, if she's interested and willing, will probably have great perspective on these questions as well. So I don't know if you want to start, Dr. Nuzzo, and then I'm happy to add anything, and I'm sure the senator likewise.
Sure. So I mean, there's some people in the camp that like all data are useful, and I generally am in that camp. But when it comes to breakthrough infections, I'm really mostly interested in people who have severe illness, in part because of how we know vaccines work, which is that, first of all, it is absolutely possible for people who are fully vaccinated to test positive as their body does the natural thing it's doing in responding to the virus to which somebody is exposed. It's also quite possible, and we've seen this happen, that people develop COVID disease. But the great news is, as we've already heard, is that they do well, which is really what the goal for the vaccines are. We would have never heard of this virus if people didn't wind up in the hospital or die from it. The question is, which one do you track? I think in my view, doing studies will better help us understand how frequently that is and how much we should be concerned of, rather than a sheer surveillance effort. And I do think that the variant data should be updated as quickly as possible, though apparently there are some operational constraints in terms of some states are waiting for a certain number of specimens before they process the results. So I think there is a natural delay built into the surveillance activities themselves.
Thanks. I don't know if anyone else wants to add to that.
Well, go ahead.
No, I really do defer to the healthcare experts here in terms of what data being released is most important in terms of prioritization. I think all of us, our sort of default position is the more accurate information that can be provided in real time, the better for informed decisions. And as Dr. Nuzzo said, certainly with respect to the upward trajectory of the Delta variant.
Look, I think Dr. Nuzzo said it 100% correctly. I'm glad you went first because I wouldn't have said it as well. You have to ask yourself, particularly in a crisis, when you're managing through a crisis, as we are doing, what you would do differently with additional information. And so the fact that we know that, there's going to be, somewhat like 10% of, that the vaccine is 90% effective against infection, and that there will be these, I think, what I think we would probably likely call false positives, means we can spend a whole lot of effort and energy on something we know is reliably going to happen, but without much consequences. And I'm not sure we would do much differently. The second question, I think, is one, though, that I think we would do probably something differently. The faster we're able to track variants, the faster we're able to declare variants of interest and concern, the better for everybody. So we should keep putting pressure on ourselves to remove those obstacles and to push those things forward. I would say that when you're running an agency, there's always a trade-off between speed and care. And I will tell you that if you're running the FDA or the CDC or CMS or NIH, you're going to get yelled at no matter which side you're on. You're too slow or you're too rushed. And when you're too rushed, you're not careful enough. And so they just have to do what they think is best, to make the best scientific decisions. There are great people in those roles. Doesn't mean we shouldn't keep pushing things to get better and better.
Thanks, Andy. Jason?
Yeah, so our next question is going to go to Nathaniel Wixel at the Hill, but just for clarity's sake, after that, we're going to go to Kathleen Amara and then we're going to go to William Ford. So just want to let people know, we do see raised hands, and we're going to be moving through as quickly as we can. So yeah. Nathaniel, you should be able to ask your question now.
Yes, hi. Thanks for doing this call, mainly for Senator Van Hollen and maybe Andy, is just how should the Senate and to an extent the House and lawmakers in general, I guess, sort of approach this, misinformation? And do you feel like some of the Republican colleagues are doing enough to the ones that are speaking out about the need to get vaccinated? Do you feel like they should be doing more to, tell some of the other members to stand down a bit and try to talk some more sense into them, rather than just speaking in generalities about, everyone should get vaccinated?
Well, I do think this is an instance where, people need to be speaking out against those who are spreading information, because it is literally killing people. And that is why I think this gathering is so important, and why we have to amplify those voices around the country who are telling the truth and calling out those who are engaging in these misinformation campaigns. We saw just yesterday, as has been mentioned, we saw Senator Rand Paul trying to undermine Dr. Fauci's credibility, which obviously has the effect of raising doubts about what Dr. Fauci and other public health experts are saying in general. And so we have to call it out. I do think part of this is naming and shaming those who are spreading misinformation, and then encouraging others to do more. So I am pleased that we've seen more and more Republican members of Congress who'd either been silent or had been part of this misinformation campaign, or at least giving it oxygen before. More of them now speaking out and calling for people to be vaccinated. They're seeing the same data that we're talking about. They're hearing, from the CDC director that, essentially 100% of people dying from COVID-19 are people who are unvaccinated. So I am glad to see that happening. I think it's really important that all of us do two things: continue to make sure that we're, spreading factual information, and that we're calling out those who are not.
I would just add to that, it's not enough, frankly, to just say that people should be vaccinated. It's time for people to tell those who are spreading disinformation to stop. It would have been time for some Republican on the committee yesterday to defend the experts It's time to stop the conspiracy theories, because a lot of this is just people saying it for cover, but they're not really doing the work to help persuade and educate Americans to do the right thing. And that's what really matters. Andy, I see you're back off mute.
Well, I think that's a great point. Look, I think you can. I heard this in Senator Van Hollen's answer. You can disagree with him or with me, for that matter, on everything else politically. You're diametrically opposed. But if you go out there and say, "Look, this is not about politics. This is about your life and about your community," as Sean Hannity did, good on you. I mean, we don't need to come to agreement on everything. When we asking people to put politics aside, it means all sides. And I think with great caution, the White House has worked very assiduously not to politicize this issue, and with many opportunities, with governors throwing challenges the president's way and the president choosing not to do that, because this isn't a litmus test. Whether you choose to get vaccinated just says nothing about your political beliefs. You can believe anything you like and get vaccinated and choose to take care of your family. That's your right. That's your opportunity. And if someone tries to tell you or imply to you that you have to follow someone's political lead because that's the party you're in, they're doing you an incredible disservice. And don't listen to me. Don't listen to Senator Van Hollen. Listen to people like Dr. Nuzzo. Listen to people like Dr. Hubner. Listen to your own doctors. Listen to people who know what they're talking about. Do not listen to Facebook. Do not listen to unreliable sources. Just get credible information and make the decision that you think is best for your family and your community. And if we do that, I think we're going to see 80% of the country vaccinated. If we don't, I think we're going to see the lows in the low 70s. And that difference in certain communities will mean lots and lots and lots of people dying.
And I would just add, the other voice I hope people listen to is the voice of folks who did not get vaccinated and found themselves in the hospital, or even sadder, the loved ones of those, and hear how they now think of those choices and what they wish they had done as a lesson to all of us. Jason?
Yep, we're on to our last two reporters. We're going to go to Kathleen Amara from WBAL. You should be able to talk now.
Hi, thank you. This is a follow-up to what was just asked, but also to Jonathan's question, which led to a discussion about vaccine mandates. Dr. Nuzzo and others earlier said something needs to be done about disinformation. What do you mean? Do you mean vaccine mandates, or is there some sort of tangible recourse to fight disinformation so the impact will resonate beyond kind of like preaching to the choir? I've seen you, Senator Van Hollen, tweeting, naming and shaming a lot over the last few weeks, but are you reaching the 30% of the population who you're hoping will hear that? What do you mean by something needs to be done? What can be done?
Well, what needs to be done is for us to continue to support the voices of the scientific community, the public health experts, and make sure that we let people know what that information is. And we also let people know that they need to be aware of misinformation. As we've been saying, I mean, fighting deliberate misinformation can be very challenging. And we need to sort of use all the methods we have at our disposal to do that. And one way is to warn people that there are voices out there in the community that are spreading this kind of misinformation. And so they need to be aware of that and ask their doctor, Dr. Hubner. If they don't, have a doctor, look to other sources. I mean, the challenge here is, trying to get people to go to those trusted sources. And I do think, and that means two things. I mean, that means one, getting the truth out. And I just hearing Dr. Nuzzo, talk about how she was subjected to these outrageous attacks for telling the truth is an example of, what we're up against, but that has not stopped her from telling the truth. And I just want to, grateful to her and everybody else who's put themselves out there. But I do think there's a role to be played in calling out those who are attacking Dr. Fauci and, calling out, governors who, decide to merchandise anti-Fauci, stuff, because that has an impact on people's psyche. And so I think we need to do both. And again, obviously it's a work in progress. That's why we're doing this today.
Thank you. I think we have one last question. Jason?
Yep, our last question is going to be from William Ford at the Washington Informer. William, you should be able to talk now.
Thank you very much. Appreciate it. This, and a lot of the questions have been asked, but looked at in LA Times editorial published yesterday. Part of it says, quote, if someone rejects inoculation for reasons other than medical, they should not be allowed to fully participate in society until this current public emergency is over, end quote. Should that be an option to do right now in terms of federal or state policy? And if healthcare experts such as Dr. Nuzzo believes this should be done, especially with a lot of the misinformation that continuously goes on. Thank you.
Anyone want to take that? No, I'll get started. I didn't see the editorial. And I think, as Andy said, look, ultimately it's up to individuals to make the decision about this vaccination. It'll be up to employers to decide how to keep their workplaces safe. And the task in front of us now is to be sure that every American can make an informed, true decision for themselves and their family. That's, I think, what our emphasis certainly has been on today. But I don't know if others have anything to add.
Maybe I'll just share that, although I expect employers are going to look at this issue and decide, what's best for their staff and their operations. I've generally been nervous about trying to shortcut the problem of overcoming hesitancy through mandates, in part because of the conversations with people that I've been having, and that there still are a lot of reasonable questions that people still need to get answers to. And I will tell you, there are many people that I have spoken to, the source of their hesitancy would not be improved through mandates, where you would take somebody who's on the fence that we can potentially still reach and put them into the category of deeply entrenched in opposition. So I personally think that we have a lot more work to do to reach people and to talk to people. And I'm really heartened to see that we're doing more decentralized approaches where we're going out door to door, et cetera. That said, when political leaders, label the doctors and nurses and other healthcare workers that are going to be going door to door and likening them to, Nazis, that is absolutely not helpful. And there needs to be strong rebuke.
Thank you. I want to thank everyone for the time today, more importantly, for the work that they do every day to keep us safe and healthy one by one and as a country. So thank you, Senator and Andy and Jennifer and Jeff and everyone who participated in the call today. Take care.
Thank you.
Thank you.